And
Yeah.
how are you seeing EMDR interact with not interact, but like how effective is it in comparison to some of these psychedelic therapies that are coming out? Like there's what we have ketamine, MDMA, psilocybin. Like it seems like there's a kitchen counter filled with them now. So it's
Right. So, yeah, like all those psychedelics were being researched in the 60s, and then it all came crashing down with the war on drugs. So they
right.
were starting to find a lot of therapeutic benefit to it, and it got shut down. So now the research um, coming out of MAPS, and which is the psychedelic
Hmm.
organization that never stopped its work, even when the government shut down all the research. Um, their findings are unbelievable. I mean, they found 67% not remission, but cure rate for post-traumatic stress disorder with 3 sessions once a month, for 3 sessions. Now, it's important, and they're finding psilocybin really good for depression. The very important thing with psychedelic research and uh, clinical work with them is that always gets emphasized in any training is set and setting. So you have to, it's not just like go take MDMA and be out and, or take acid and, enjoy the sensory experiences.
Right.
If it's going to have therapeutic value, you have to do it with a guide. You have to have an intention therapeutically. What do you want to work on?
Hmm.
When you're in with the medicine, when it's affecting your brain and your perceptions, and then you need to integrate the experience therapeutically
Right.
afterwards.
Well,
So there's a lot of good research going on. The issue, like even for myself, is waiting for, at least in the States, what they're saying is that mid to end 2023 is when it's likely to be legalized for therapeutic use.
wow, that'll be floodgates.
It'll be floodgates. And
Right.
so many of us have gotten the training, but
Hmm.
we're waiting. We're waiting to be able to offer the treatments. I think there are states already where it's legal. Oregon, don't quote me on it. I know
Hmm.
places in Europe, but these studies are going on all over the place. And Yale, NYU, these are places in the States, big New York University, John Hopkins has a big psychedelic center. A
Well,
lot of
and how do you
universities.
feel about these people? Some people being trained, like you said, you've had training in it as well, and there's other institutes that are training, and I wonder how scientifically rigorous they are, opposed to like staying more on the quote unquote spiritual side. Where I have friends that have gone to these sessions where there's like 10 or 15 people in a house, and everyone is taking psychedelics. It sounds insane to me.
Right. So, that's like go have fun and have a
Right.
great spiritual experience. And it could be ends up to be change your life,
Right.
because suddenly you see the interconnection of everything
But
and
don't
all of
pretend
that.
it's a controlled environment. It's very
But
much not.
it's not therapeutically driven. They could say it is, but the research is not on those experiences. The
Right.
research is on trained psychedelic therapists, very seasoned, with people who've been screened for PTSD and diagnostically and all of that, and within a very therapeutic setting
Hmm.
to have the medicine once they decide what they're going to work on and to continue to integrate the work. So that's the research that's coming out now. There might be, there's always good research and bad research.
Right.
So it's going to be up to people to be able to decipher that. Most people really, unfortunately, just don't have training in it. So
Right.
they don't know. But it's looking very promising. And the trauma field is particularly keeping a big eye on it, because if you can cure somebody of post-traumatic stress, somebody with severe post-traumatic stress where nothing else has helped, in 3 sessions over the course of 3 months, that's something to jump up and down about. And that's going to help a lot of people.
Wow. I even looked